What is the Telemedicine project?
Global Offsite Care encourages Rotary clubs to help put telemedicine in the hands of doctors and hospitals in other countries from the U.S. And the way we work is to partner up with a host Rotary club that is familiar with a hospital that wants a telemedicine project, and we work through them to provide the equipment that is used to connect doctor to doctor using video chat or other technology to help diagnose and treat patients.
Then the doctors come in, and then we try to do three things. One is consultations on the equipment that you provide. They request a consultation, and we'll do that generally with an Android pad or with an iPad or an iPhone. Secondly, we have an educational session once a week in which we give a topic that's germane to their practice of medicine, and we include their topics, and we'll include their patients in terms of presentations on an international go-to-meeting setting. And the third thing we're going to do, haven't done yet, and that is to provide to each hospital that participates an electronic medical record. Very unique. It's cloud-based, and it'll enable the hospital to organize the ICU, to make the information available to us so we can do a better consultation. Consultant's only as good as the information you have. Seeing the patient, looking at the images, looking at the lab data, and putting it all together, so that administratively, if Mike can sign up the hospitals and get them all worked up, ready to go, we can come in medically and do consultations, education, and really help run the hospital in terms of this electronic medical record, which is in the future. We haven't done it yet.
Why do we need or want telemedicine in the world today?
The goal of telemedicine is to provide specialty care where it is not. We can really provide a lot of help quickly, knowing the patient, a diagnosis, and what to do. Or if we don't know the diagnosis, doing a differential diagnosis and finding that. But it's taking specialty care, the best level of it. We're trying to provide expertise where it's not.
Given that we're planning to take this globally and different parts of the world have different levels of development, how would this work with the most basic level of technology and information that is present?
The internet is becoming more and more available, so we're getting right to the cutting edge of that rollout. Right now we use cell data networks, which are widely available. So we work with each project to find out where are the gaps and try to fill them from the hardware level. But also, I think bringing it to people and offering it to them, it takes a process of getting acquainted and utilizing it. So the way it starts off is we invite them to grand rounds, and that enables them to hook up over the internet. They get to see Dr. Gude's presentation and hear how he presents, and they get to get a feel for who are they dealing with. For example, in Haiti, we had a doctor just say, you know, it's not good to practice medicine in isolation.
Why Rotary? You know, as a physician, I really want to take what we know to other places. Rotary is the perfect partner to do this. We've got medicine, but Rotary has, I think, what is it, 34,000 clubs and about 1.2 million members. The fiscal responsibility is Rotary. They are local. They have controls. And I've done things like this without these fiscal responsibilities, and it's like dropping a dime into a bucket. It's lost very, very quickly. But I like the integrity and the ubiquity of Rotary.
One of Dr. Gude's colleagues was saying, you know, for me it's great because it expands the number of patients that I see who need my expertise, and that keeps my knowledge fresh. From the hospital's point of view, expands their capabilities without having to hire people or recruit them, because that's difficult in a lot of places, and then especially for a rural location, it's not easy to get any doctors at all. So I think those two factors really argue for telemedicine.
And any physician who works for us, we request that they do 2 gratis consultations per month. These are cardiologists, infectious disease people, pediatric critical care. There's a real humanitarianism behind this. Now, if you look on the wall, these are all pictures of Albert Schweitzer, who was a great physician in Africa. He's sort of our, let's call it, inspiration, our muse, which is really to give service in the world using medicine via the medium of telemedicine.
When I first heard about it, I pictured my, village in Kenya, where every time I visit, the last time I was there, I ran into an auntie of mine who had what would be considered a minor condition here that can easily be diagnosed and treated. But the lack of any medical accessibility made it a very big deal, and probably the situation got worse than it needed to be. So I'm really excited about this. I mean, this way she gets exposed to first-class medical knowledge, from UCSF here. So for me, I'm really excited about this project. I can't wait to see it go worldwide. It's gonna save lives as far as I'm concerned.
You see, I got a call during your talk.
Mm-hmm.
That could have been on this iPhone 6, a call from your village.
See?
Asking about your aunt.
It's
It really could, because that's the way we do this.
that exactly.
I mean,
exactly.
It's that easy.
Very.
I get a call like this and I say, yes, I'll have someone call you who's a specialist in this field.
Right.
And I
right.
call them and they call back, and it's all done very, very quickly. But your village could call me directly right now. There's no problem.
It's wonderful.
Just
You know,
like
if I could
that.
get another call right now, that may be them. I don't know.
What a lot of people are going to want to know is how easy it is to sign up for something like this.
Right.
The high road for that is to connect to our website, which is globaloffsitecare.org. And that can trigger a message to me as Rotarians. If you attend the Rotary International Convention, we're present there and we can start the process that way. So what we ask is people give us their email and their cell phone and their name, and we send them information about the project and a couple of things to capture exactly what it is we're offering. So we have a memorandum of understanding, which includes what we expect the host Rotary Club to do and what they can expect from us. And that's how we start.
One more question I had for you is, who are the players involved to see this come to completion and have it go on in the long term?
Global Offsite Care is one of the players, and it's positioned itself as kind of the glue that puts this process together. So we reach out to Rotary clubs in the U.S. to help contribute financially, and also some leadership. We connect with them, and also the hospital that hosts the project would do the same. So we're usually dealing with the medical director there, and Dr. Gude then connects one-on-one with the medical directors and other people interested at the hospital. So that's how the players get put together.
That's the organizational glue. The medical glue
Yes.
is really Habit and Telemedicine Foundation. It's another nonprofit, and all the doctors work under Habit and Telemedicine Foundation for Global Offsite Care to get this done. So we really want to reach a large number of people doing this.